As we all are locked down at home due to the current circumstances of COVID-19, let us think some of the psychosocial problems related with COVID-19. As a social worker, we should know about the various psychosocial issues related with COVID-19 and we should subject them for our research purpose, casework and case study. Which are the major psychosocial problems? The first one is quarantined in hospital. We know that people, those who are the carriers of coronavirus, are quarantined in hospital for a long time. They have fear, worry, tension, and disappointment. They are not in contact with their family members, friends, and colleagues. We can give them good mental support and we can also advise their family members or colleagues to give them a better social support by providing positive talks through mobile phone. The next psychosocial problem is home isolation. We know that people those who are coming from abroad or people those who are in close contact with coronavirus patients are isolated for a long time. They have a fear in them that what should be the attitude of society towards them. We should also give them a good mental support through remote communication accesses. And the another problem is movement restriction. We are sitting in our home for a long time during the past 3 weeks. The feeling of restricted movement can also lead to disappointment and anger in people. The next problem is lack of medication and treatment for people those who are suffering from cancer, heart disease or renal problem. They are also tensed in this situation whether they should get better treatment or proper medication. And another category of people those who are facing psychosocial problem is people those who are using alcohol or drugs. They have a they have withdrawal symptoms and they possess a lot of psychological issues related with it. And what should be the short term impact of this problem? The first one is fear of falling ill and dying due to COVID. The second one is avoiding health care facilities. The third problem is they have a fear that whether they will lose their jobs. Social exclusion, boredom, and powerlessness are also another issues. And what should be the long term issue? Lack of social network, avoiding communication with friends, neighbors, and colleagues, and uh, weight gain or laziness to do work. These are also another long term impact. Anger against government frontline workers, relapsation of mental health disorders and substance abuse disorders. People those who are suffering from mental health disorders and substance abuse disorders, they may be relapsed for a long time. And how can we tackle this problem? We can tackle this problem by consultation with various professionals such as doctors, counselors, or social workers. We can also arrange a person to person or focused interaction with healthcare workers such as PHC worker. And we can also strengthen the communication between the family members and neighbors. And advocacy from higher institutions such as government and NGOs are also another solution to this problem. And what are the basic psychosocial care techniques regarding with this issue? That is, first one, we should be physically and mentally active. The second one is keeping in touch with family members, neighbors, etc. through mobile phones. And the third one is get the support through helplines. Fourth one is be aware of positive changes in our society. There are a lot of positive changes are taking place in our society. So we should consider them. We should think about the lack of environmental pollution, the good deeds done by our neighbors and the other people, those with a good service mentality. And the fifth one is limit the viewing of news channels regarding COVID-19. So many news channels are spreading negative news related with COVID issues, and we should avoid such news. And the last one is be helpful in this difficult situation by volunteering at major or minor level. We should always be helpful to public at any level. So I hope that we can use this information for our research purpose, casework and case study. Thank you.